Hey everybody, it's been a while since I did a video. It's another rant about gastroparesis. I'm just gonna be honest. I'm gonna be blunt. The healthcare system absolutely sucks. They are failing me big time. As you all know, if you have gastroparesis or idiopathic gastroparesis, it's paralyzation of the stomach. That means you have a tough time keeping food in you. It hurts to eat. You feel full after a bite or two. I've been dealing with this for almost 15 years now. And this year alone, since January, I've had 17 hospital admissions because of this. But yet, every time I go in, they say that they're going to do, they're definitely going to get me a feeding tube because my muscle mass is deteriorating. They can see under my eyes that I'm getting sicker. You know, I have to basically crawl to get up to the second floor because I just don't have the strength to walk up the stairs normal like you would. But my admission before Thanksgiving, they got somebody that works with people with drugs, drug issue. They came down, questioned me, asked me questions, passed with flying colors. She said, I don't see why I'm wasting my time here. You don't need help in this aspect. And then I went home. 3 days later, got sick again. Just got so dehydrated. As you know, if you have GP, you deplete your fluids from going to the bathroom so much, because I have IBS and a touch of Crohn's as well. Between going to the bathroom and throwing up or just not eating because I know I'm going to throw up, it's depleting everything again. Well, I got admitted in again November 30th and just got out 2 days ago. And this trip, they got psych after me. She comes in with one of her colleagues in training, and I'm like, no, you're more than welcome to sit and talk. I have nothing to hide. I said, but I'm going to tell you, I'm not going to waste my time to talk to therapists. I have gone through 24 of them since I've had this, and you people are not going to tell me to do anything different or eat anything different that I haven't already done in the past. She said, you don't need us. I heard her go out to the nurse or to the doctor at the nurse's station and say, it's a waste of time. She needs help with whatever's going on with her stomach, not her head. So yeah, it's getting to the point now where they're starting to get these people down. They can do whatever they want. I can give a rat's ass. I'm hiding nothing. I am sick. I have been for probably longer. It's been documented on the paper for 14 years. Probably longer, because I remember as a child, I was sick like this a lot and in the emergency room. So probably a lot longer than almost 15 years. But what's getting me is I have this pain in the upper part of my abdomen. And the last time I had it, I had a small bowel obstruction, and that was in 2010. I had the pain in the upper left side of my belly, and I had pain going into both sides of my back because that pain it just wrapped around like a circle. Well, long story short, I go to the hospital, and they do every scan. They always do CT, MRI, X-ray, ultrasound, and it all came back normal. And I said to the surgeon, which I won't mention his name, I said, no, you need to go in and you need to do exploratory surgery because something's wrong. I could feel it. He goes, I'm a surgeon, and I've been a surgeon for over 30-some years. I said, I understand you have, but respectfully, I'm going to argue with you. I said, because I'm telling you, I'm the patient, and I feel that there is something wrong. This is not just my typical flare-up. And he goes, well, if you're still in pain by a certain time tomorrow, then we'll do the surgery tomorrow evening. And I said, okay. I didn't even make it past 3 o'clock in the morning. He ended up doing emergency surgery on me, and he found a small bowel obstruction with bands wrapped around it, and he found a hernia. And the reason why he couldn't find any of that on any of the tests that he ran is because I've had previous surgeries from a C-section, partial hysterectomy, my gallbladder and appendix was removed. I had cysts removed off my ovary when I was younger. So I've had quite a bit of surgeries. And all those adhesions just stuck like glue, like cement, and they covered it. Well, when I came to, he was holding my hand. He had a face cloth on my head, and he goes, I am so sorry that I even had second thoughts on what you were saying. I'm sorry I judged you. I said, I told you. You can't judge a book by its cover. You're the first case in the 30-some years that I've been a surgeon that I've ever come across like this. I said, I can guarantee you I'm not the only one in the world that this has happened to. Now, to get to what's going on now, when I went to the hospital, started in January, is when that pain started again. And I keep telling them, it feels like when I had the blockage. I'm not saying that's what it is. I said, but none of the tests showed anything. I said, he did an exploratory surgery, and he found all this. And the doctor goes, well, it's good that he found it, but the problem with that, I said, is more adhesions will grow. I said, I understand that, but from 2010 up until January of 2023, a little over 10 years, I had no pain in the upper part of my abdomen going into my back. I just had my normal gastroparesis pains. So I thought something was going to get done. Nope. Dietary came down again, saying we're going to get a GJ tubing you. You've lost more weight. Your muscle mass is deteriorating. Nope. They sent me home, throwing up and everything, but they sent me home and told me I need to go see my PCP. I looked at the doctor that was taking care of me. I said, you're funny, doctor. I said, because every time I try to talk to her, oh, there's nothing I can do here for you. To the point where she's now sending a nurse or a physician assistant to my home to try to get an IV in me to get fluids. And now it's to the point where they can't even get IVs in me anymore because my veins are so shot out of hell because of all the admissions I've had. I've had over 1,100 admissions over the past 14 years at this one hospital due to gastroparesis, due to the vomiting, dehydration. 1,100. Well, I'm fighting for a TPN so I can get some nourishment because I don't eat. When I do eat, it's applesauce, Ensure, chicken broth, and water or Gatorade. That's what I consume or try to consume. Sometimes I eat nothing because the pain and the nausea is so bad, but I'm not there yet for a feeding tube. But it was a necessity to get me a wheelchair though, because I'm so weak. And so I can get to my doctor's appointments. It is a necessity to get me a shower chair because I can no longer stand long periods of time in the shower because I'm so weak. It's a necessity to had gotten me my Ensure so I can get some sort of protein and nutrition into me. but it's not a necessity to have a PICC line put in. I understand you can get infections from it, but that's where antibiotics come in hand. I'm tired of being told I'm not there yet. It's just not fair to me. And these doctors take the oath to help their patients to the best of their ability. No, they don't. Not when they get psych after you, or they're getting, people in the crisis team for people who have drug and alcohol issues. They get them after you. What's going to be the next step? They're going to try to put me in a nursing home or something? No. What they need to do is get off their asses, and they need to do something. Some sort of feeding tube. They don't want to cut me open and put a feeding tube in me? Fine, I understand that. But put a goddamn PICC line in me so my stomach can get some rest from food. And put the PICC line in me so I can get the nutrition that I need. And then reintroduce foods little by little a few months later. I strongly feel, and I've spoken with many doctors and many nurses and many people I've become friends with in the GP community, have said the same thing. I've got TPN, or I had TPN. It did wonders. I'm not able to eat a whole bunch, but I'm eating a little bit better, prior to now that my stomach has rested, But I'm not given that option because they say I'm not thin enough yet. My labs look okay. But yet, I've had 17 admissions since January of 2023. And here it is December. 17 admissions. From vomiting, from passing out. 17 admissions. That's scary, knowing what these generation of doctors are doing now. Can you just imagine 5 years from now how much worse it's going to get? Because I strongly believe when it comes to females, we do not get taken serious about our health conditions, but men are. And I have nothing against men, but I've noticed and I've known people that get better care than I do. All because I had one good gastric emptying 2 years ago. The old GI I had said that I'm cured of it. No, there's no cure for it. You can go in remission, but there is no cure for it. And I'm not in remission because every 2 weeks I'm in the hospital with dehydration or not enough nutrition. Yeah. What the fuck is going on with doctors today? What is going on? Because you can't see pain doesn't mean a patient isn't in pain. It's called learn about our diagnosis before you start seeing what's good for us and what's not. For 13 years, I did nothing but extra strength Tylenol. Did nothing for my stomach. Heating pad. Did nothing for my stomach. And a couple of other medicines did nothing for my stomach. My doctor this year just finally had to put me on pain medicine because the pain is so bad. If I eat, the pain's a 10 out of 10. Like right now, I try to eat, the pain's like an 8 out of 10, and my stomach is distended. Do I want to go back to the hospital? Yes, because I'm in pain. But will they take care of me? They'll just look at me and go, well, you were just here a few days ago. That's what gets me. They tell you to come back if this and this and this is going on. You go there, and then they look at you like, what are you doing here? to me, totally fucked up. So what is the point of having a doctor, any doctor, whether that's a PCP for a common cold, whether you go to an oncology doctor for cancer, or you go GYN for your female issues, or you go to a gastroenterologist for your stomach issues, or you go to hematology for your blood issues. What difference does it make? Because nobody's doing anything about anything. So what makes the point? I don't think it does. For me, I don't think it does. Perfect example. 10 years ago, I got that. Well, not 10 years ago, geez. I'm sorry. 14 years ago, I got diagnosed with the gastroparesis. And then in 2011, I was at a hospital with my fiance, and I passed out. And that's why I was there, because I wasn't feeling good. I thought I had pneumonia again. I had pneumonia, and I have 2 nodules in my left lung. Nothing's been done about that. No biopsies been done. Nothing. No x-ray to see if it's gotten larger, at least to focus on that. Nothing's been done about that. And then in 2014, I was having some really nasty pain in my left breast. Comes to find out I have a 6 centimeter, probably bigger now, in my left breast. I only went for 1 mammogram. Do you know, once again, they didn't do a biopsy. So why in the hell am I supposed to have trust in doctors, nurses? How am I supposed to have trust? Some people say I'm being paranoid. No, I'm not being paranoid. I have been gaslighted all my life, more so since I got the gastroparesis, and I'm tired of it. When I go to the doctors, I expect my doctor to do something. Not send me, oh, you need to go to the hospital. I can't take care of you here. Your veins are just absolutely horrible. Now it's to the point where the hospital, when I'm there, has got to have IV team come down. Now it's to the point where they have to have a special machine look for my veins, because my veins are so bad. But yet I'm not there for any feeding tube, any ports, any PICC lines. I'm not there yet for any of it. Where's that fair to me? Where? But I can guarantee you that if I was a rich person, if I was a celebrity, or I was just a wealthy person, I can guarantee you, and I know this for a fact, I would get better care. But because I am on state insurance, I am dirt on the bottom of their shoe. I'm not the only one that is going through this, and I'm not the only one that has seen it. I've seen it in certain hospitals, and I was in Boston, how a very wealthy person, you can always tell when somebody's wealthy just by the way they dress. Oh, they get the proper treatment. They couldn't get doctors and nurses in there quick enough for them. But me, I'm sitting there 5-6 hours ahead of this person, and this person goes in for a tiny little thing, but yet I'm still sitting there in pain, throwing up. So it does prove that if you have better insurance or you're wealthy, you will get taken care of the way every patient in this world should get taken care of. And I think it sucks. I think it's sad. I think it's unprofessional. I think it's unethical, and it's uncalled for. Because whether we're with money or without money, we all get up the same way, get dressed the same way, and breathe the same way. And we should get treated the same way when it comes to medical situations, not pushed to the side. So the healthcare system, I feel, is rigged. And once again, I'm not the one that agrees to that. It's a fucked up healthcare system we are in today. And I could just only imagine how much worse it's going to be for my kids, and their kids, and my great-grandkids. I can only imagine how tough it will be for them. I pray that things will change by me putting videos up like this. I pray that somebody higher up will see this and help me get this out there somewhere. I pray, because it's not fair the way patients like me are being treated. It isn't. It isn't. And then to get psych after you and other departments after you because they think you're looking to do drugs, or they think it's in your head, and then you pass with flying colors. I think that was the best thing, hearing them say, she's not what you think she is. Both of them saying she's got stomach issues. She needs help with that. That made my day. But yeah, to get back to the hospitals, yeah, I see it happen all the time. I've gone on trips with my fiance and ended up in the emergency room, and because I had Massachusetts, where I'm from, I had the insurance, and forget about it. I was waiting and waiting and waiting. A wealthy person comes in, once again, got taken right in, got admitted in for whatever the situation was. All they did was send me home with painkillers, and that was that. So yeah, it goes to prove worldwide, no matter where you are in this world, there's a good portion of patients that are chronically ill like me, that are because we're women, we're not being taken serious enough of our conditions. Because I've had doctors say, oh, you women just complain about every little ache and pain. It's called gaslighting. And then I've seen men get treated with, okay, let's get him into this now. Oh, let's get him up to surgery. Oh my God, sounds like you have an obstruction. But me, I'm sitting here telling them that this feels like an obstruction from like when I had 10 years ago. And they're looking at me like, well, you ain't getting the surgery. I'm getting no feeding tube and I'm starving to death. Hospital has documented that I have severe malnutrition. My IVs infiltrate every single time I go to the hospital. I'm an ambulatory wheelchair user because I can only walk so far, and then I get out of breath and my legs start to get extremely weak, and sometimes I collapse. I can't stand no longer to take showers. I have to sit in a shower chair, once again, because I'm so weak, because I have passed out due to the lack of nutrition in the tub. Hence if I've got a shower chair. And I'm on Ensure. But right now, there's a shortage with Ensure because they feel they're not going to deliver to my house, because right now the company, which is Abbott, that has Ensure, is only making it for me to go buy at the store or for people with feeding tubes. They'll deliver to people with feeding tubes, not a problem. But people like me have to go pay $30 to $60. All depends on how many cases you get. And I normally get 4 cases. So that's $80 a month. Where is that fair to me when I have an illness that I have to go out and buy my food, my nutritional drinks that are keeping me alive? Where is that right? Now I'm getting screwed by this? No, I don't think this is fair at all. And I'm pissed. I'm pissed. And I have all the right to be pissed. My life has been robbed for almost 15 years. When they know what needs to be done, they've addressed, oh, we'll do this, we'll do that. And nothing ever gets done. First set of GI doctors asked me if I knew what a PICC line was, and at that point in time I didn't know. They explained it to me and said, okay, well, I want to send you home with it. I want your stomach about 5 or 6 months. Give a break. You just eat like Jello and just soft stuff, pudding, and stuff like that, mashed potatoes. But we want you on TPN. Okay. I was out for it. Got the PICC line in, headed in for 3 days in the hospital. I'm ready for admission. They had already taught me about the TPN. And another GI comes down and says, oh, Dr. So-and-so wants us to put in for the IV team to come down and pull the TPN out. I said, why? Dr. So-and-so wants me to go home with this. Well, he's changed his mind. I said, well, I don't know. I said, no, when it comes to something like this, I don't know is not the vocabulary. No. So they sent me home. I ended up back in the hospital about a week later. The two same GIs that had my PICC line pulled that week prior comes back in, puts another one in. Tells me the same thing. Want you to go home for a few months, have your stomach rest, and then we'll reassess everything with another gastric empty. And I'm like, okay, but why did you have her pull it out? And they try to give me some story that it wasn't them. Whatever. I wasn't going to fight with them because I knew they were lying. Well, I'm in the hospital 2 weeks this trip. And they see how sick I am. And they're like, yeah, we're definitely going to send you home. Day of admission, they had the nurse pull out the PICC line. And I demanded to see them. Nope, they wouldn't come in the room. So I got up. I went for a stroll. I seen them at the nurse's station. I said, can you explain to me, not once but twice, why you have pulled the PICC line that you and him both said I need? And they just got up and walked away. Never got an answer. They dropped me as their patient. Never seen him again. Never seen him again. And every admission I get, like this past admission I just got 2 days ago when I got out of the hospital, my nurse goes, you need a port, you need a PICC line, you need something, because I am so bruised from being poked so much to the point where they had to put a midline in me. I don't know how much more I can do with this. I don't. And people tell me, just breathe in through your nose and breathe out through your mouth. Do meditation. I've done meditation. I've done acupuncture, if I'm saying it correctly, with the needles that go through you. I've done therapy. I've done holistic medicine. I've done all that. Believe me, before I even started doing any of that meds that they give me. And none of that crap helped. If it helps them, that's great that there are other patients out there that stuff will help. But what helps them, what helps you, may not help me. So, all they want to do is put me on a medication that they kind of sedate people with. I will not mention the medication name because I don't want to get banned, don't want to get suspended, and I'm not doing it. Not doing it. I don't like the feeling that I had when I had it once, and I refuse to have that 3 times a day. Sorry, not going to happen. I can barely function now because I'm so weak, and they want to add another medicine on there that's going to make me sleep all day long and all night long. No. Sorry, but I'm not going to do that. What you doctors need to do if there's anybody in the medical field that's watching this, listen to your fucking patients when they tell you something is wrong. Because you take x-rays or PET scans, CAT scans, whatever you call it in your hospital, or MRIs, or ultrasounds, and because shit comes up negative or you can't find something, does not mean that there's something not going on with your patients. It's called, you don't know everything. Even though you went to medical school, you don't know everything. It's a proven fact. Stop gaslighting us. Especially us women. Stop gaslighting us, saying that we're making more of our pain than what's there. Listen to what we gotta say. Please. Because by gaslighting us or pushing us away, you're not helping us. You're actually making us get sicker and sicker. I'm one of them. None of my team will listen to me. They just brush it off. When I tell them what I'm feeling, they just brush it off. Or I get, if you feel that you're starting to get dehydrated, make an appointment in a few days. And I get dehydrated, it just comes on. How the hell am I supposed to make an appointment when I don't know when dehydration is setting in? Sometimes I could feel it coming on, and sometimes I can't. And yes, I have tried to call and make an appointment to go down there, and now I get the excuse that my veins suck, so they want me to go to the main clinic. No, I'm not going to do it. Sorry, not going to do it. If your team can't get an IV in me, then you need to figure out another way to get an IV in me. You come yourself to my house and put that IV in. Yeah. It's just sad to hear that more and more people in this world is passing because of the gastroparesis or the side effects that we have from it. It's sad. I know somebody, and I won't mention names, and if you see this video, I love you, girl. I'm there for you. You need to talk, you've got my number, call me. But she has what I have, and she just lost a very dear friend that was more like a sister to her from complications of gastroparesis that her doctors were saying was in her head, or it's just flare-ups, or she was just looking for attention. She was just starting out in life, and she passed away Monday. Such a young, beautiful soul, gone too long because they didn't want to listen to her. They didn't think that her stories, as they say, weren't real enough. They didn't believe she was in the amount of pain that she said she was, or they didn't believe that she was vomiting as much as she said she was. Nobody should have to suffer the way that poor soul suffered. Nobody should have to suffer. Now she's gone. If the healthcare system was better worldwide and these doctors listened to her, she would have been able to live her life. She would have been able to get married and have a family. She's lost all that because her life was lost due to the medical field not listening to a damn thing that this poor woman had to say. How sad is that? How sad. I didn't know her personally, but I cried when I read about it because that's me. That's what's happening to me right now. Everything she went through, I've been going through. Nobody's listening to me. Nothing. Nobody listened to her for the longest time. And she got her feeding tube, and they still didn't listen to her, that her stomach was hurting her. It fucking sucks. It's scary. It really is. It's scary for somebody to say, we don't know what's causing you pain, so we're not going to give you anything for your nausea or your pain. Because you don't see what's causing the pain doesn't mean somebody's not in pain. You have no right to deny us pain medication. Get your act together, doctors. Get your act together, doctors worldwide. Because one of these days, we're going to hear this on the news, that patients like myself are losing their lives over complications due to gastroparesis because people like you don't want to help us, because you feel we're just females and we're making more of it than that's what's really there. All I could say is I hope we can get some real doctors in this world that actually will listen to chronically ill patients like me and take us serious and go that extra mile and say, hey, okay, none of the scans showed anything. Let's go in and do a little exploratory surgery and see what's causing that pain. We'll start off by going in a little, and then if we feel we see something but we need a, then we're going to go for a little bit further. We need doctors like that will do something for us, and maybe we would be able to live life just a bit better. That's all I want. I want to watch my grandson grow up. I want to watch my adult children get into relationships, marry, and have family of their own. I want to watch my grandson get married and have children of his own. But if I keep going the way I'm going, with a lack of intake of anything, I know I'm buying a one-way ticket to heaven. I know I am. And believe me, I'm fighting. But nobody's hearing what I'm saying, and it's sad. I hope this video reaches somebody out there. As I need help. I'm starving to live, if that makes sense. And it's not fair that so many of us are dropping like flies because of the healthcare system. We just want to live. We want to thrive. We want to have some sort of normalcy. We don't want to be sick anymore. Just want to live, that's all. Now, I know this was a long video, and I do apologize, but I just had to get this out there. If you like my content, I'd appreciate that you click that bell. That way when I do put a video out, you will be notified. Subscribe, like, comment, share this if you want. I'd greatly appreciate it. Thank you and happy holidays.